Historically, again, coca leaves have been utilized in, South America for millennia, and have been, consumed orally, in the form of tea or chewing, for a very long time. But in Europe and North America, from the 1920s to the 1970s, there was definitely, increased use, basically. But it was often in very specific, kind of cultural, communities. There were a lot of artists that used it. Apparently, Freud enjoyed his Vin Mariani. But then there was this rather dramatic increase in the 1970s, due actually largely to new methods of cocaine administration, particularly insufflation, right, snorting, which is topical administration to the nasal membranes, and also IV injection, and then sort of a second significant increase due to smoking a freebase form of cocaine known as crack. And what that does, of course, that shift in the method of administration moves towards much more rapid delivery of the drug to make it bioavailable to targets in the brain, and so that increases significantly the risk of dependence on the drug. So extremely rapid drug delivery again is a risk factor for the development of a drug use disorder. So that really, that was a change in sort of how these drugs were being consumed that had pretty substantial impacts on on the number of people who became dependent or addicted or developed a drug use disorder regarding cocaine.